Hey, good morning, everybody.
An early flight. I had to
We are
drive
going
over
to go ahead and
Washington.
get started as it
I'm a
is
maniac driver.
10:01. Thank all of you again so much for being here today. We've got a ton of people in the room, which is really exciting, and we also have quite a few people joining us via the webinar. So thank you all so much. You've come from near and far and taking the time to be here with us this morning. We are really grateful and really excited that you're all here to be part of this conversation. For those of you who are joining us via webinar, I mentioned this a little bit ago, but just as a heads up, we felt like to facilitate dialogue best, we wanted to leave the lines open, so they are unmuted. So if those of you who are here via the webinar, if you want to go ahead and mute yourselves so we don't get any background noise, please feel free to do that. But also, like I said, please chime in throughout the presentation as you desire and want to contribute. We want to hear from you, so that's why we left the lines open. If we need to go to a situation where we need to mute, we can do that too, but for right now, we're going to try keeping everyone unmuted. Also, just want to give everyone a heads up that we're recording the webinar so that if you want to relive this conversation or if you have colleagues who wanted to be here and couldn't make it, they can check out the recording. We'll post it on the eval RFP page of our kansashealth.org website. So feel free to tell anyone else who couldn't be here to check it out there. So just wanted to talk a little bit about why we brought you all here this morning. First, some of you are really familiar with the Kansas Health Foundation and some of you are not. And as we get ready to release this RFP, we thought it would facilitate the best proposals to give you some insight into who we are as a foundation and the work that we're doing and the work that we anticipate we'll be doing in the future. So we just want to give you some insights there. We also want to talk to you a little bit about the actual RFP document and the sections that we're thinking that we're going to include at this point. And then also get some feedback from you all as likely applicants on things that you think would, again, facilitate the best proposal process. So just offering an opportunity for discussion and feedback about the RFP document and the process as a whole. So I wanted to give our team a chance to introduce ourselves as that first piece of insight into the foundation. For those of you I didn't get the chance to meet, and for those of you via webinar, I'm sorry, I probably should have said this right off the bat. This is Nadine Long. I'm a program officer here at the Kansas Health Foundation. And I have the honor of managing our evaluation work moving forward. The foundation has a really rich history of doing some exciting and innovative evaluation projects. So I'm really excited to be here, be a part of the team, and be working on this. And with that, I'm going to hand it over to Jeff Willett, who's our Vice President for Programs and Policy, to take it from here.
Well, thanks. Yep, Jeff Willett, thanks for that introduction. We're going to have each member of our team introduce themselves. I just wanted to thank all of you for being here or for participating today. As Nadine said, we appreciate this opportunity to have a conversation with you before we release an RFP for what we believe is an incredibly exciting opportunity for someone to apply for and for an organization to win a bid for. So I'm going to talk a little bit about the foundation, but first I want to express appreciation for you and also to someone many of you have worked very closely with over time, Deanna Van Hirsch, who's been our Director of Evaluation and Program Administration in the past, and she's now the Assistant Vice President for Programs. So Deanna and I get the privilege of working with our colleagues to really implement the strategic direction of the foundation, and we get to carry out the kind of the direction that our board sets for our work, our board's ideas for how to improve health in the state of Kansas. And we're also the two folks who are really accountable to the board to let them know we're making progress. So anyway, if we just go around and the other KHF staff that are in here, introduce yourselves and just a couple thoughts maybe related to the day.
I'll go first. I'm Elisa Buller. I'm the grants officer here at the foundation. Just a couple of things that I do in my role is I manage a couple of our databases. I work with designing online applications and requirements and reporting. Also work with grantees in designing agreements and payment processing. So if you have questions about payments, I work with grantees on that.
And I'm Jeff Usher, Program Officer at the Kansas Health Foundation. I 18 years, I can't believe it. And my portfolio primarily is focused on healthy behaviors in places like communities, schools, work sites. I also oversee our GROW work, which is giving resources to our world around local philanthropy, working with community foundations across the state and building their resources, and then a lot of our leadership work in Kansas.
Good morning, everyone. I'm Shawn Brown. I'm a program officer here, and one of my primary responsibilities is the Community Engagement Initiative, where we are investing in 5 communities to help them create a more healthier and thriving neighborhood. And I also work with the Recognition Grants program. Many of you may be familiar with that, our responsive grant-making opportunity for you. And so that's a little bit about what I do. I've been here with the foundation for about 4 years now.
I'd also say good morning. Jeff partially introduced me, but my name is Dee Hirsch, and I've been with the foundation for a number of years as well.
I guess I don't have to stand up, it's a webinar too. But for those of you who are just joining us on the webinar, welcome. Thank you for taking the time to be here. The lines are unmuted, so if you don't want us to hear what's going on in your office, go ahead and mute your phone line. And also in the room and via webinar, if you wouldn't mind, when you get ready to ask a question or make a comment, if you'll just say your name and the organization that you're here with, I think that'll better facilitate the dialogue. Thanks.
Great. And if anyone's having trouble hearing me or hearing us, make sure that you let us know, and we can stand a bit closer to the microphones that are placed throughout the room. And if the background noise for the people on the phone gets too loud, let us know, and we can mute some of the mics that are placed throughout the room here. So my task during today's meeting is to provide a brief introduction to the Kansas Health Foundation that will give you an idea of our strategic framework, where we're heading over the next few years, and also to give you examples of current evaluation efforts. And some of you will see your own work today. Some of you work with us and won't see your work. There's no disrespect intended with what is presented. What is presented today is meant to provide examples of evaluation work that we believe is high level, not specific program evaluation necessarily, high level work that's most directly related to our new strategic framework. So again, apologies in advance if you don't see your work. And if I don't mention your work and you believe that it applies, it certainly does. And for those of you who have not worked with the Kansas Health Foundation, this is your opportunity to meet us. So all of you will have questions. We welcome the questions. Just so the people who are here in the room with us know, I have until 3 o'clock open on my calendar, and I intended to have lunch. If people want to have lunch, or if you want to have side conversations, myself and several other members of our staff are available. If you want to know more about KHF, if you have specific ideas or questions for the RFP, anything, I'd say it's fair game. So I'll go ahead and kick it off here with our new strategic framework. The foundation went through a strategic planning process over about a 1.5 year period, where we were really looking critically at the work that we have done the first 30 years of our foundation, thinking about the state of health in Kansas, and thinking about what we need to do, or what we need to do going forward to improve the health of the state. So our board worked and identified this vision statement. The foundation had never had a vision statement, so as the process of vision a culture in which every Kansan can make healthy choices where they live, work, and play. And what is behind that vision is our belief that not every Kansan has equal opportunities to live a healthy life. And we really look at our role as helping promote and support culture change in the state of Kansas, creating more opportunities for Kansans to live a healthy life. We took a look at our grant portfolio, and we took a look at our previous focus areas, and kind of reassessed that work. And we went from a framework that had 5 focus areas and a whole bunch of things that we called emerging opportunities that actually, in a lot of respects, had become the majority of some of our staff's time, and reconfigured things and settled on 2 overarching program areas. I just want to say at the outset, these are not distinct program areas. There's not a bucket that's one thing and a separate bucket that's another. It's kind of 2 distinct types of goals that we're working toward. One we call health equity, and that's focused on reducing disparities related to social and economic factors. And within that, we believe we should operate at 3 levels. For folks that are ill or that need to receive treatment or need to access the health system, we want to make sure that there's access to affordable quality health care. We also want to continue focusing on prevention. The foundation has been focused on prevention, specifically promoting physical activity, supporting nutrition, and reducing tobacco use for many years. So we also want to prevent people from chronic disease related to preventable causes of death. And we also realize that there's a tremendous opportunity to explore what we can do with social determinants of health. Your zip code, where you're born, where you grow up, the resources that you have, race, ethnicity, whether you live in a rural community or urban community, etc. All of that plays a tremendous role with regard to health. And so that's a brand new area that the foundation will be exploring, and we hope to explore that work with an organization that can help us with research and evaluation services. So that's health equity, and we're going to work across those 3 levels. The other program area is civic health, and the notion of civic health is one that the Kansas Health Foundation had been focused on for a while, but not intentionally focused on that. We didn't call it that. We have the Kansas Health Institute, Kansas Leadership Center, many other leadership development programs, a lot of capacity building work, a lot of work to engage Kansans at the community level and so on. So we just decided to call it what it was. We have a large grant portfolio that's focused on civic health and engaging Kansans to improve the health of our state. And historically, we've done that through leadership development and capacity building. We've done it through generating actionable data, which many of you that have worked with us have been a part of that. And this notion of actionable data, I really want you to take that to heart when you're thinking about developing a proposal. This is not academic. This is a partnership that will help guide our actions, help us with our long-term goal, kind of promoting a culture of health in the state of Kansas. And media and journalism, which we've supported in many ways. I think currently we're supporting the KHI News Service through our grant to the Kansas Health Institute, doing other things as well. But just recognizing that informed Kansans are more likely to be engaged Kansans, and informed Kansans are more likely to make decisions that they believe are in the best interests of their health and the best interests of their community and the state. So those are our 2 program areas, and we really need partners who can help us further define how we're going to go about accomplishing these 2 goal statements, engaging Kansans and reducing health disparities related to social and economic factors, how we can ensure that we're able to communicate back to our board whether or not we're making progress toward these goal statements, helping evaluate specific programs, helping collect data where we have data gaps, all these wonderful things. I don't want to, I'm not overstating how large of an effort this will be. And again, that's where the examples that I want to show are examples of large scale and somewhat complex evaluation or research efforts. As an organization, we make progress toward our goals through grant making, through policy advocacy, and through strategic communications. We're also exploring how we can use some of our investment portfolio. So eventually you might see investments or program-related investments as one of those strategies. So new strategic framework. So I'll pause here and see if anybody has a question or there are questions or two before we move forward.
Can you say more about actionable data? Can you give more definition to that?
Well, sure. Previously, we called it health data and information, and we changed it to actionable data because we want to...
Your line is now muted.
Say my name, I'm sorry.
If people cannot hear me, it will be difficult for you to tell me that you can't hear me, but hopefully our line's not muted. So actionable data, we want to ensure that as we're approaching evaluation and research work that we're thinking intentionally about dissemination.
Your line is now unmuted.
Can everyone who's on the webinar hear me now? I guess could someone tell me that they hear me?
Yes, I can hear you.
Yes, I do.
I can hear you.
Yes, we lost you, but we hear you now.
Okay, well, great. You lost me. Apologize for that. So there was the question about actionable data, and previously we called.
Your line is now muted. Your line is now unmuted.
Okay. I think you can all verify I'm not doing anything. I don't even know where the system is that would do that. I'm going to put that down. The clicker. So actionable data is the term we're now using for what we used to call health data and information. And we want to ensure that our research and evaluation work is done with dissemination in mind at the outset and dissemination across a number of audiences. Our board is a primary audience. Policymakers in the state of Kansas are a primary audience. Just the media is a primary audience. So that's, again, just as you're thinking about your proposal, as you're thinking about how you can help with dissemination, as you're thinking about how you could, structure a team, just keep that notion of actionable data in mind. I think we've done wonderful work at KHF, and I've told our board, we're sitting on mountains of data. We just have so much. And what we really need to do is just focus on the dissemination piece and focus on knowledge management, how we can learn from the data that we have, how our whole staff can learn from the data that we have and the data that's available that you could bring to us. And that's really, I think, the big transition we need to make as an organization. We have a lot of really sophisticated, wonderful evaluation and research occurring in Kansas, and our team could use some help kind of with KHF basing our decision making more on the data and using the data to help shape what we're doing. So yeah. Okay, actionable data. That's a mindset you can bring to the proposal to help us across these two program areas. All right, so in the save the date mini RFP notice that Nadine sent out, that many of you've probably seen, we refer to the types of activities that we're looking for someone to help us with. That mentioned theory of change development, monitoring knowledge, attitudes, beliefs, and behaviors of Kansans, evaluation of programs or initiatives or media campaigns, that the foundation may implement, and formative research to help inform our future efforts. So I want to provide examples of a few of these. The first is our theory of change for our prevention area, our prevention-related activities. So we've worked with RTI International for several years, and they helped us refine our theory of change for our prevention work. So I'm not going to go through in great detail, but to help you understand us, I think this is a great, walking through the theory of change at a really high level will help with that. So at the foundation, we recognize that there are really two levels that we operate at least, to promote health, to reduce tobacco use, promote physical activity, and improve nutrition. So we kind of refer to the north and south pathways to prevention here. So the upper path, which you cannot read all the details of, is largely traditional public health programs, more focused on intervention at the individual level and behavior change at the individual level. And all that is important. All that has a place, all that is relevant, but really reaching people and helping support in a variety of ways them in improving their health. More of a program track. So we've funded the diabetes prevention program through the YMCA, bringing people together. So that's an example of a program. We also recognize that policy and systems and environmental change have probably the greatest impact on population health. So the southern track is really focused on policy and systems change. And our preference when we're thinking about our work is to start at that level, thinking how can we work at the systems level to change the environment so that it's promoting and supporting health. Okay, so this pathway is really important, the southern pathway, and we've worked over the years, we've just blown this thing out in any number of ways. So the theory of change, started out kind of, this is a basic level of detail, became more complex as we were thinking about measuring progress and how we're going to know, we're making progress over time. So we really blew out this southern pathway to focus on, there's a slide that it's kind of missing here, but we're thinking of policy changes requiring stages of awareness to will to action. You need to build awareness. There needs to be awareness of the issue, awareness of the problem. Then you need to generate the will for people to act, whether it's at the individual level or if it's a policymaker. You need to really generate will for them to take action based on their awareness of the situation. So, and then it's the action. And we think both in terms of, if we're talking to the public, we want that action to be contacting policymakers. We want that action to be joining a coalition. We want that action to be being involved to support policy change. And with policymakers, we want the action to be establishing or implementing policy systems or environmental changes that are going to support health. So this is our prevention theory of change, which just personally, I love this. I think it's guided our work well. I think we can continue using this to make better decisions, but the organization we work with will be kind of presented with, here's what we have for prevention. Let's talk about that a little bit, but we need this level of thought around social determinants of health, around our entire civic health program area. We have not gone to this level of effort with any other aspect of our work. It's just an example of how we're thinking about this and what we likely need to do going forward. Innovation Network has been the evaluator for our Healthy Communities initiative. And a slide that's missing, which is actually reflected here, is an advocacy framework. It's an advocacy framework that we have used to guide a lot of our planning. And so, you've got the awareness to will to action as the outcomes for this framework with different audiences down below, the public, influencers, and decision makers. So what Innovation Network did through interviews, review of information from our Healthy Communities grantees, more of a qualitative analysis of the work that was underway. They've helped us understand what the Healthy Communities Initiative teams were doing to advance policy. This is when this initiative has been at a fairly mature state. You see a lot of action across this advocacy framework. And I think that the thinking around this advocacy framework and the evaluation and the reporting for this initiative has really helped that initiative make more progress, make greater progress. It's also helped us as a team, and Jeff Usher is the program officer for this initiative. I think it's helped Jeff in terms of being the program officer for this initiative, help ensure that the communities have the support that they need. So Jeff will see, well, over this period of time, this particular community seems to be kind of at a real basic level. They're just holding meetings, but they're not actually getting out there and doing anything. So then Jeff's been able, and the team that supports that work's been able to get involved. So this is taking part of our prevention theory of change, that policy track, and here's how we've used evaluation that is based on that overall theory of change for prevention to guide our work and to support our grantees. Okay, then when we're thinking of how do we measure progress, so for prevention, as you all know, there are a lot of existing data sources that you can go to for health behaviors and health outcomes, and so those are listed there next to the outcomes or the impact that we were looking for. But there were also a lot of data gaps, especially at the state level. So again, working with RTI, we designed we designed a survey for Kansans. 2,303, I think, Kansans responded to a survey asking about knowledge, attitudes, beliefs regarding physical activity, nutrition, tobacco use, and obesity, and had a comparable, in terms of the survey instrument, a nearly identical survey instrument for opinion leaders across the state of Kansas. So, quick example, just for the opinion leader, there were 912 respondents for that survey across these sectors or types of leaders. So we had, we had elected officials in there. We also had business leaders. We had the media. We just had folks who were influencers in that advocacy framework, and asked them questions, and then saw interesting things. So, when asking whether or not the following are very serious problems in Kansas, again, thinking awareness to will to action. You need to know it's a problem. You need to have will generated to act. Well, we see kind of a disconnect between the public and our opinion leaders in Kansas, where the public is more likely to strongly agree that overweight, obesity, unhealthy eating, lack of regular exercise, and smoking are serious problems for our state. Kind of have the public in many respects moving in a good direction, and boy, we need to catch our policymakers up to that. But then what I found interesting, and helping us move forward in a thoughtful, strategic way. What I found interesting in this study was, despite the fact that the only 20% of opinion leaders thought smoking was a very serious problem, opinion leaders were basically as likely as the public to support tobacco control policies. So that's just a weird disconnect. You would think if they didn't think it was much of a problem, you might be less likely to be in favor of policy, but we didn't find that. We found, and this is just strongly in favor of, when you add in favor, you end up with the majority of support for the tobacco measures, I believe. But a lot of support for increasing the cigarette tax, for funding tobacco prevention, for outdoor smoking restrictions. You see a difference with tax on sugary drinks, both for the public and decision makers. So a couple years ago, we were part of an effort to support increasing the cigarette tax and fully funding the state tobacco prevention program. Having data like this helped us have confidence moving forward with that. At the same time, we decided we were not going to move forward with the tax on sugary drinks, right? The environment is not ripe for that in Kansas. That would be ridiculous. So again, the work that we're looking for will help inform our grant making, our policy advocacy, and our strategic communications. An example, so this is the TCC group and the Docking Institute conducted a study of Kansas communities, individuals across Kansas communities, looking at local leadership, civic engagement, and trying to identify what are the top concerns among Kansans across communities. So again, I think this is a great example of work that can inform the foundation. This is going to be really difficult for you to see, but it's just the results to a question that asked the respondents to identify how important different issues were for their community. Here's where we put a lot of our effort, the health, physical activity, nutrition, or obesity. And basically less than 10% of respondents in the four communities we focused on in statewide really identified that as a critical local issue. There are a number of health things. We're looking at the economy and poverty as the top issues across the state, with folks in Garden City being more likely to mention immigration. So the work that the opportunity to explore what we can do with social determinants of health is meeting the needs of the state. And certainly, we're going to continue our prevention work. We're going to continue work with regard to access to health care. But economy, poverty, housing, education, when you ask Kansans what the important issues are, what the problems are, that's what we have. We know that any progress there will also improve health. So being able to track and monitor this type of information over time at a high level is really important for what we're doing. I mentioned our civic health program area, and the goal statement for civic health is to engage Kansans to improve the health of the state. We're currently working with the National Conference on Citizenship using current population survey data to look at different measures of civic health and civic engagement in Kansas. We've really been struck, as I guess it wasn't surprising, but the extent to which there are differences in civic engagement across different socioeconomic groups has been surprising, the gaps that we see. So this slide, an infographic from a fact sheet that we developed that looks at voting in local elections, and the percent of Kansans who say they always or sometimes vote in local elections, and the difference, 27% of Latinos in Kansas say they always or sometimes vote, compared to 62% of white Kansans. With household income, fewer than half of Kansans with less than $35,000 a year household income say they're likely to vote in local elections, compared to 63%. When we look at contacting elected or public officials, we see similar disparities. 9% of African Americans and Latinos in Kansas have said they contacted a public official in the last year, compared to 16% for whites. And then a big difference as well with household income. And as you all know, health outcomes and access to health care are poorer for Latinos, African Americans, lower income, Kansas with lower levels of education. So when we were exploring civic health, we confirmed suspicions that health disparities mirror disparities with civic engagement. And as we're approaching our civic health work, we believe that by empowering and supporting efforts to engage more Kansans, we'll be more likely to see that culture of health. We'll be more likely to see health promoting policy change occur in the state. Okay, and then like random lists to capture everything else. Over the years, a number of evaluations related to public health investments, public health programs, a health home model, immunization program, you name it, go down the list. We've funded a number of evaluations for public health programs or initiatives. School-based efforts. We currently have Let's Move Active Kansas Schools that's being evaluated through partnership with the Department of Education. Other things that we need some assistance with, I think from a conceptual standpoint, we have a grantee reporting system where we've tried to really align our reporting in a way that allows us to kind of quickly monitor whether or not grantees are meeting objectives. We have a reporting system built around that advocacy framework that's also been helpful. So a number of other things we currently support. And the concept here is, the assumption here is that knowledge management and KHF learning from our evaluation and research investments is challenging when there are many separate organizations and many disconnected evaluation projects underway. It makes it even more challenging for us to look at the big picture, to pull out nuggets and inform our work. So the concept we're talking about today is, as much as possible, kind of an umbrella, overarching approach to the evaluation. And Nadine's going to talk more about that.
Thanks.
But first, any questions? Again, there will be time for questions at the end, but yep.
Yeah, I have one. Scott Wittick with the Community Engagement Institute, formerly the Center for Community Support and Research. You mentioned a lot about knowledge development for KHF staff and your board. How much also are you thinking about your grantees or your other close partners in this type of information, getting back to them and informing their work? Is that a priority for the RFP? And maybe you're going to get to that.
It's a priority.
Okay.
Yes. Yep. That would definitely be a priority. I think first and foremost, we're a grant maker. We write checks and we figure out how we can support other organizations. So yes, our partners are across the board are also an important group. So okay. Thanks.
All right. So Jeff's done a really great job talking to you guys some about work that we are a little bit more familiar with, and we look forward to engaging with our new partner in moving forward. But we also, moving forward, we're not sure what it's all going to look like, if that hasn't been clear yet. But one thing that we are relatively sure that we will need is a partner who is comfortable with and excited about helping our grantees build up their own evaluation capacity. I mean, the nice thing about talking to evaluators and people who are familiar with evaluation is that you guys know all this stuff, so that makes my job easier here. But I mean, I'm sure you can remember a time where you weren't as familiar, and it probably felt a lot like this word cloud. Our grantees have got 1,000,001 things that are going on, and evaluation is just one of those. And it can feel really overwhelming. There's a lot of pieces to keep track of, and what do I track, and what do I not track, and how do I learn from it? So as a foundation, going back to our relationships with our grantees, I think we're really interested in helping them build up their effectiveness at all levels, and evaluation is one way that we can do that. So again, just looking for a partner who is comfortable in that work, and that will be, I'll talk more about this later, but that will be one thing that we'll be asking for specifically on the RFP. And then related to that, if you all as organizations have any experience with collaborative or empowerment or participatory evaluations, please include that experience in the narrative. So just to give you a little bit more of a framework in terms of how we as an organization approach evaluation, Jeff, I mean, I think really hit home the point that at every level, grantee, initiative, strategy, field, we are trying to learn, we are trying to help our partners learn so that all of us together are making the best decisions possible. KHF also as an organization holds a number of values but I felt like 4 of those really stood out in terms of how we approach our evaluation work. One is that obviously we try to be a strategic, proactive funder. We want to make the best decisions possible, and evaluation is critical to that. We want to be accountable. For those of you who are familiar with Kansas, I'm sure you've heard our stat from America's Health Rankings. In just over 20 years, we fell from the 7th healthiest state to the 28th. Did I get that right, or the 27th? Okay, so those are the numbers. We fell really far is the point. And so we don't have time to not be effective. And I think the community is holding us accountable to making progress on our mission. And so again, evaluation is really critical to that. We want to be transparent internally and externally about what we're learning and what we're not learning, and changes that we need to make. And then collaborative, and I think this goes back to your question, Scott. We, as a foundation, really value our partners, and especially our grantees. They're the ones who are operationalizing our mission every single day, and anything that we can do to help them be more effective and make progress, that's what we want to do, and that's where we want to be. So now to the RFP. I've jotted down up here the sections that we are planning on presenting to you all to respond to in the document at this point in time. My guess is that a lot of them are going to look just like any other RFP that you've responded to. I think organization description definitely falls into that category. We're going to ask you to talk about the size of your organization, number of staff, your mission. One potentially unique part of this section is we welcome applicants to come on behalf of a partnership, but within this section, we'll ask you to talk about who you are approaching this work with and what the structure of that partnership will look like. So just make sure to include that information. Key team members, I think that's pretty obvious. We are just interested in getting to know as much as possible within a proposal who we're going to be working with on a day-to-day basis. And then, so applicant experience is where we're going to get more into the things that Jeff talked about earlier in terms of the experience you have and that your key team members have in terms of developing those surveys, identify the knowledge and the attitudes and the beliefs of Kansans, theory of change development, that research to inform our grant making and potentially communication strategies. And then we'll also leave some area for you to go into a little bit more broadly any experience that you have in mixed methods for quantitative and qualitative program evaluation. And then applicant experience, that's also where we're going to get more into the nitty-gritty in terms of the evaluation capacity building. So that's what we're looking for there. In terms of content expertise, this goes back to Jeff was talking about our 2 areas, our 2 focus areas within our strategic framework, health equity and civic health. And then I think within health equity, we're also going to drill down a little bit further and ask for more details if you have any to offer in terms of experience with specifically social determinants. Because as Jeff mentioned, that's an area that's more new to us. So having a partner who's got some experience in that area would be really helpful. Approach on that mini summary invitation sheet that I'm sure you all saw that got you here today. We mentioned there were a few things that we would prefer, and under approach, that's where we'll ask you to talk about your familiarity with Kansas communities. Obviously, a partner who is familiar with the Kansas environment. We don't operate in a vacuum. We are part of a larger system, and having a partner who's familiar with that obviously comes with benefits. So we'll be asking for you to describe that there. And then I feel like Jeff's really hit home the point that what we are looking for in this project is actionable data. And so within this approach section, we'll also be giving you an opportunity to describe more of your experience in terms of making the data you've collected in the past, I'm using the phrase optimally actionable. So if you've turned things into infographics so somebody could use it, you helped someone prepare a slide deck, or you came and made a presentation to their board. Those are all kind of more creative examples as opposed to just handing them the standard evaluation 100-page report with 18 appendices. So. And then references, I'm assuming that is probably pretty standard. We're just going to be looking for 2 references that you have in terms of clients who can speak to the quality and experience that they've had with you as an organization. So I want to just reiterate a little bit about the RFP. As you go through it, it might feel a little bit vague, but again, I just want to circle back to the point we've made earlier, which is that a lot of this is new to us. And so we're looking for a partner who can kind of be comfortable in the ambiguity along with us, and be flexible as we figure out using the data to figure out what we want to do as an organization, and then just coming alongside with us in that work. If that makes sense. So I also want to mention that as you're writing this proposal, just please hold in the back of your mind that we are looking at this as a place to start a meaningful conversation. So the proposal in and of itself is by no means the beginning and the end of the investigation and the vetting that we'll be doing in this area. We do plan, I'll mention this again later, but we do plan to bring in top candidates to come and make a presentation to our selection committee. So just, like I said, hold in the back of your mind that this is a place to start and not the end. Okay, so that brings me to our timeline moving forward. The RFP we plan will be released in the next few weeks. We have November 30th kind of as a target date. We're going to ask that you submit a letter of intent if you do plan to apply by December 21st. If you have any questions about the RFP, the process, KHF, hit me up anytime, phone, email, person, whatever. And I will respond to those questions as I receive them, but then the deadline for that will be January 11th. And at that point, what we'll do is compile all the questions we've had and then post that to the eval RFP section of the kansashealth.org website so that everybody is aware of all the questions that have been asked and the answers. We're aiming for February 1st in terms of when proposals will be due. And then we, as a selection committee, would like to have a recommendation to make to our board at their April 20th meeting. And that's where they'll hopefully give us our approval that we need to move forward and develop a contract and get started on this really cool work. And so if I haven't given it to you enough already, there's my contact information. And with that, unless Jeff or any of my teammates have anything else that they want to add, I think at this point we'd love to open it up for questions and discussion. And I'm not seeing any like big hands, so since I can, I'm going to ask the first question of you all, which is, I would love to hear about any experience you have responding to this type of RFP, and if you can give us some examples of things that stand out in your mind that have been really helpful in helping you develop a really thoughtful response. Does that question make sense? So things that you liked about previous RFPs that you responded to and that helped you put together the best proposal. Yes.
Melissa Walker from Wichita State. If you could wait or give us some sense of what your priorities are. There's a lot of moving parts here.
Yes.
Assistance with grant making, assistance with grantees. That would help.
Okay, thank you.
I'm Matt Shepard with Midwest Evaluation Research. Do you have in mind a length for this document to understand how condensed we need to have the information on, or how verbose you?
Yeah, I think that's a great question. I know in my mind between 15 and 20 pages is kind of what we're going for, without like resumes and attachments and all that other budget good stuff. Does that sound reasonable?
Well, yeah.
I'll just tell you from a writer perspective, that seems tight.
It does seem tight.
Given the amount of information that you want and the level of detail that you'd be looking for, this would be more like a 50-page one that I would be responding to. But I'm not saying I want a 50-page proposal, because that's a ton of work. So, but somewhere in the middle, I mean, that just 20 pages just seems like,
okay.
We're going to, not that that's bad, because you really crystallize what's important, but it is going to leave some information out.
I appreciate that feedback, and we'll balance the desire that you all have to clearly and thoroughly explain your expertise and experience, along with the fact that our selection committee will be looking at this as one of many other projects they're involved in. Thank you for that feedback. Yes.
Question on the phone?
Oh, yes. Sorry. Yes, please.
Yeah,
was trying to understand, being new to you, are you looking for having like one contractor to help you in all of these areas, and is it over a certain amount of time? Or are you trying to put together a little bit of a group of different contractors that might be stronger in one area or another and might collaborate with you in different ways?
We are certainly open to either approach. We are asking for a number of things, and might be a tall order for any one organization or any one department or center to provide the full range of support that we're thinking of. Nadine mentioned early on that we're really intrigued by the notion of partnership, of collaboration. And I would say I think that collaboration is particularly important if we were to give this award to an out-of-state organization. Having an in-state presence, in-state partnership would be a great thing. Proximity is important. To evaluate, you have to understand the program almost better than the program staff. You have to understand at a different level. So yes, we're also expecting a multidisciplinary team or an organization that has the ability to bring on board other staff, other researchers that can answer questions or troubleshoot. So to answer your question, it's not an either or. It's kind of just whatever looks like the best approach, best proposal to get.
Okay, yes, do you mind, Vincent? Go ahead.
Thank you. Vincent Francisco, University of Kansas. Really, a couple of different things, if I could just put 2 points out there. One is encouraging you to ask for non-traditional or things that are closer to some bodies of evidence that will help you understand the kind of collaboration and the kind of experience that folks have. So if you all ask for an evaluation report, that's what you're going to get, but that's not what you want. And so asking for that, it might be a story along with a slide presentation, or a couple of stories that could describe where people have developed collaborations over time with a little bit of evidence and maybe even backed up by a reference. Might get you a little bit more mileage than asking for some evidence, like an evaluation report of what it is that you might want to go at for the future. And then secondarily, thinking about the page length and what it is that you want, breaking it up between what you want for narrative, which is probably going to be fairly short and to the point, and then what your attachments are going to be and what level of latitude for attachments that you may just want to get an overview for. I've seen some foundations get a lot of mileage out of both approaches, so that they have essentially the executive summary that's the narrative. And I find that that's better to write towards as well. Okay. It's harder to write towards because to say it more succinctly, you've got to be really careful with your writing and write it a few times before it ever leaves your desk. But I think you'll get a better product at the end. The other thing that I was thinking about, though, the big question that I have is, to what extent are you going to be facilitating collaboration among partners? So you get 3-4 proposals. You're really going to like them a lot. I'll bet you there's going to be 3 or 4 that you're going to really struggle with, and I hope that you will. Get 3 or 4 that are going to be hard choices. To what extent are you going to be facilitating a partnership arrangement between those, which could be pretty interesting and exciting within this?
I think there's certainly the potential for that. And Nadine's point that the proposal's not the end and the beginning. Awesome. It's a starting point and then helps us, I think, figure out where to go from there. So
Cool. I think about it as a sampling. We'd like to give you a sample of what we can do, kind of a thing. And so
Think about being the Kansas Health Foundation and having to choose a winner and loser from K-State, Fort Hays State, Wichita State, KU. It's not an enviable position, right?
And a few of these folks are friends of mine.
Yeah.
Including folks in this room.
Yeah.
And so, including the folks here at the Kansas Health Foundation. And so that's why I was thinking, gosh, wouldn't it be awesome to use this opportunity to facilitate some things that could really add up in a really novel way? That would be very cool.
So are you willing to facilitate now so that we know who's here and which pieces we're thinking about?
Well, I think it would, be challenging for the folks on the phone, but perhaps when, like if we close the Q&A and folks want to chat, that's great. Like I said, we're happy to stick around afterward. What I was going to say is don't leave it up to us to create partnerships out of individual proposals, work together. There's tremendous expertise in this room, and if we could work with every single one of you, and if we could tap into everybody who's on the phone and bring all that together, that's great. We don't have the resources for that, or that's tough. But so as you're thinking about responding to what you know about us and what's in the RFP, and folks that excel in certain areas, please partner together. So
awesome.
Yeah.
Given that this is work in progress, as you're describing it, as the foundation learns as it's implementing the new strategic vision, and you'll be working with, I really like the idea of evolving and creating partnerships. Is there a time frame set in the proposal? I mean, it's going to take a few years to get really even up and running and started, and then ongoing. So my question is do you have in mind a specific time frame for this initial proposal?
Well, the timeline for the grant will likely be a 3-year grant term. We pretty much have a policy, it's more a practice with our board at this point, where even when we know it needs to be a longer term investment, we want the board to be able to make a decision before we move forward. So, it's just, we envisioned this would be a long partnership, that it would take considerable time to get up and running on some parts of the work, and other things probably move a bit faster. Yes. So the term, basically for almost all of our grants and contracts at this point, is maxed out at 3 years. But that's with the understanding that, yeah.
Well, this is Jennifer James with Harder & Company Community Research, and my question is dovetailing a little bit on yours. There's a little bit of tension between the accountability frame that you're suggesting that's really drilling down to results, as well as the adaptive strategy to be able to build and kind of maneuver in the most appropriate way. So my question is not so much about the time frame as much as the phasing of the work, and what the appetite is of the board to kind of wait on some of these things and allow it to emerge.
That is a wonderful question. And I can't speak for the board or individual board members. I will say that the board is really interested in how we're going to measure progress, and the board wants to be more aware of and engaged in the learning that that's going on. So, but that said, I also know that the board is very appreciative of and receptive to the information we have now, and sometimes it's just the trick of figuring out how we package it together in a way that it's meaningful information for a group of people that gets together once a quarter. How do we, in kind of small bursts, let them learn with us and share learning with them? So I don't think the whole thing I don't think the board, the board has a healthy appetite for information at this point, but I don't think it's the full-blown implementation of a theory of change around civic health or social determinants and why haven't you made more progress in the last year. just even understanding the understanding the state and communities and issues, I think, is a great starting point. Yeah.
This has been so wonderful. I've been just enjoying this whole vision. But as an evaluator, you usually worry about exactly what you're trying to do in terms of the budget. And I know this brings up an uncomfortable, I just suck the air out of the room. But, I know it sometimes as an evaluator, you worry about the Pinto version of the budget, and you go to the middle size, and then you have the Cadillac version. So should we just shoot for the moon, or how should, we all think about that? Because because you have to, you can't just, we know you do have a budget that you have to stay within constraints, but should we be worrying about that, or should we just say, this is what we're going to do, and we don't want to overpromise?
So that's, I think, the question that we could use the most help with. So there are any number of approaches we could take. We could give the overall budget for what we think the board will approve and say, go at it. Yes. Or we could...
Tell us that. It gives us an idea. You're asking for a lot.
Let's hear the other options, though.
Well,
we're talking about hundreds of thousands of dollars. Yeah. So how many hundreds of thousands of dollars are you committing?
Other things we've talked about, again, for the proposal being a starting point, we've talked about, I don't know if scenario is exactly the right word, but really focusing on the team and the expertise and the organization and what the proposal brings, and then using providing a budget for a specific scenario and letting you tell us how you would be cost effective and how you would optimally respond to that need. And then if some folks are way off the mark or out of the realm, when we multiply that by however many things we would want done, then that helps.
Usually when RFPs are issued, the entity that issues the RFP says, here's how big the pot is. This is what the federal government does, right? And this is how many grantees there will be. There might be 1, there might be 10. So if you could give us something along those lines, that would help.
Okay.
And
this is Jennifer from Harder & Company again. A specific example right now that we're working on with Colorado Health Foundation is that they're kind of in a similar situation where they're working on some of their strategy. They're doing things like collective impact, which is all over the place and hard to manage. And so what they started doing is that they have kind of issued the top level of the evaluation that they want to provide, but then they broke it into either quarters or 6-month tranches. And so that you have a regular feedback loop and kind of be able to adjust the time and the work, and then they can scale up or down within that. So maybe even just to your point, it's kind of giving the upper level, but then making sure that you have those regular check-in points just so that you can adjust. I would imagine that this is going to kind of accordion in and out, well, mostly just accordion out, it sounds like, during the first part, and then you'll need to adjust and focus as you work on, capacity building or, evaluation results-based or the strategy part.
Yep.
So having a regular tranche check-ins would be helpful.
And those of you who are grantees of ours or contractors of ours or partners of ours now, you have a good idea of how we approach things. You have a good idea of what budgets for individual projects have been, but you may not have a sense for the whole, for the entire pie. So the foundation does make a substantial investment in evaluation, research, and data. And so there's also probably the reality, you talked about accordioning in and out, which that's hard to say, but it's also likely that as things evolve and as over time, there may be additional resources available to scale up different parts of this. So, yeah, we're not going to terminate any current agreements to fund something new. We're transitioning a lot of work. So.
You sounded like you were encouraging people to think about partnerships up front. To facilitate that process, do you have plans to share a list of the attendees today?
This is Nadine. I'm more than happy to do that. If you would not like your name shared that you were here today, please let me know. I don't know why you would, but if you do, let me know. Otherwise, you'll be on the list.
Yeah, if you're not supposed to be here today, let us know.
This is Karen Chang from KU. Can you talk a little bit about your existing evaluation infrastructure? Do you have a unit? Do you have somebody who's kind of in charge of evaluation currently?
Let me take a stab at that. We have Deanna Van Hirsch has been the director for our evaluation portfolio and manages many of our ongoing evaluation efforts. I, unfortunately, for a lot of reasons, I was the director of evaluation at a health foundation before, and just in my backgrounds have a lot of interest in evaluation and like to be involved in evaluation. Nadine has a strong background in performance management and grant program management and evaluation. I think those are the three core individuals that will kind of be thinking strategically at a big picture level, but also knowing that all of our program team, all of our communication team, our senior leadership team, we also, one goal that I have is that there's greater engagement, across the organization. But I think in terms of who the team has been, it's the three of us that would be the team that would work with folks. Again, Deanna and I are accountable to our leadership team and to our board. We kind of share, in different ways, have different roles with our team, but from initiative development, implementation, grants management, evaluation, policy work, the two of us really oversee that part of our work. And Nadine has been with us for a few months, and her role is really that kind of the knowledge management component, really helping ensure that the evaluation is meaningful and relevant and shared with our staff and helping share with our board. So not a lot, not an evaluation unit. We're a 22-person organization. I probably got that wrong, but and 9-member program staff, 3-member communication team, some administrative team, and kind of our leadership team, and that's it. And we have 24-hour days, surprisingly, as well. So I told Nadine this morning, I said, so that as this rolls forward, I'm going to want to be plugged in, and I'm going to have really strong opinions when I do plug in, but I'm not going to be like between those conversations, my time's going to be limited. So just warning. So it's up to you to help shape those strong opinions that I have between these calls. So, yep.
Yeah.
It's a lot of work. Just unless there's a strong negative reaction to presenting a situation, a scenario, a need that we have with a budget for that, so that we can, I think it's as much in the apples to apples sort of vein, that as we're scoring proposals and we're making decisions, if we give everyone, just make up a huge number. If everyone has a huge number, there will be such a variety of proposals and approaches that the only thing we'll be left with is we've got to combine all these into one because there's so many great things, versus it's one or two things and how can we move forward with that information. So I think we were still on that question in some ways. But
yeah, we kind of are.
So
Yep.
you're not trying to hire an entity that's going to do evaluation, but maybe you are? I mean, I'm confused.
Yes, there will be projects or initiatives that we need someone to evaluate. So our Let's Move Active Kansas Schools initiative is an example. Huge investment through the Department of Education in something to increase physical activity throughout the school day. Well, is it working? Why would we invest in that versus just paying every school to purchase Go Noodle, which is a program we have to answer that question. We also know that in a lot of ways, building the grantee capacity around evaluation, ensuring that there are resources through our grants to support, grantees investing in evaluation, and having someone help shape that work is important. The larger, it's all important, but there may be evaluation projects that come up. And the way that we approach that now with our prevention program area is we work as a team, we work with the evaluators and do kind of an evaluability assessment. And we have kind of a budget for program-specific evaluation. We have those conversations for a year, decide what makes sense and how to invest those dollars. So we don't evaluate everything, but there are just some initiatives or programs that would require pretty robust evaluation.
And are you asking for evaluation of the foundation's grant making?
That's been a part, yes, I think that's been a part of the work. Yes, there are certainly aspects of what we do now that are evaluating our process. And
I think if I can just chime in too, going back to that pretty little smart art that I was able to insert at the grantee level. Yeah, thanks. That took a while. The grantee level and then the strategy level, field level, those are all levels at which we're trying to work and learn and do better. And sometimes it's going to involve a specific program, and sometimes it's going to involve the 5 community engagement grantees that are involved in our community engagement initiative. And then, as a broader field, what are we learning there and how can we contribute? So I think it's all of that. And then within the strategy level, how are we doing with civic health? Are we making a difference? And how do we figure that out? So at all of those levels.
Yeah.
Good. Was there a question over here on this side of the room? Yes.
Yeah, I'm Cindy Schumann from Kansas State University. So you mentioned a couple times about the massive amount of data that you already have and exists.
That's great.
So would you see that mostly the work would be looking forward, trying to help future directions, or is there going to be a certain amount of trying to dig through and learn? I mean, obviously build off of what you already have, but how much is working with what's already there and how much is future?
I think it's more future.
More future. Okay. Thanks.
Do we have any questions on the phone that we've missed? Okay. Got a lot of work.
Yes.
Okay, go ahead. Thank you.
Yes. This is Valerie, and I'm asking on behalf of Astrid Hendricks. He would like to know, trying to find those questions real quick. He would like to know, do you have summaries of the evaluations that you presented today, and if so, are you willing to share those?
Yes, we will work to share some of the products that have come from our evaluations. So certainly the slides, and then yes, we will have some examples available. That's an onion that once you start peeling it back, you'll never get to the center. Just there's so much. So I think we'll probably try to identify those things that we think are most relevant, again, from a big picture standpoint, that reflect the work across our 2 program areas, things that we think are good examples going forward. So we'll have to do that. Yeah.
He also had another question.
He wanted to know if you can give a sense of the organizations that are participating in the bidders call.
Yes. We have a variety of in-state academic institutions. Jeff named off a number of them earlier. We've also got some nonprofit evaluators in the room and on the call, in-state and out-of-state. Yep. I think that summarizes it. We've got like K-State, KU, Wichita State, Fort Hays State. All of them have representatives either in the room or on the call. And then Jennifer's here from San Diego. We've got some RTI representatives here in the room. And then we've got several nonprofit, and I'm sorry that I don't remember your exact institutions, the agencies that you're here with, but a number of nonprofit evaluation organization support type people who signed up. And we've got quite a few people that fits on the call. So yeah, and that list, we'll make that list, like I said earlier, we'll make that list available too, so you can see exactly who is here today. And thank you all again for being here. Yeah, Sarah.
Nadine, you mentioned sort of a vagueness in the RFP, and so I'm wondering too, as we work on these proposals, what level of specificity versus flexibility would you all like to see? You know, do you want us to get into like these are the specific methodologies we would recommend based on these types of things? So get into like very specific levels. As opposed to these are sort of some general ideas that we have, and we're really interested in working with KHF to discuss what would be most appropriate or what you would most like. So that balance of sort of specificity versus flexibility.
I think that describes perfectly what the RFP will look like. In any given section, I think that's important. Why that exact point is why it was important that we say this is the start and not the end of the conversation. Because it feels like in a lot of evaluation RFPs, we're looking for 5 goals and this is what they are. We're going to evaluate this exact program, and we're not doing that here. We're asking for you to come to us as an organization with your team members, your expertise, and then the experience that you have, and then we'll figure out how we can best move our evaluation work forward based on that. So that is a challenge, and I apologize, and I appreciate you guys kind of making that judgment call when you see the RFP. And like again, my contact information is everywhere. So if it gets to a point where you have a specific question, I am more than happy to kind of vet that with you. But it probably was really unhelpful. So sorry about that. Anything you want to add to that, Jeff? Yes.
It's Jennifer again. So I'm sure that you're going to be getting a lot of questions after this, and the questions that my colleagues are going to be asking are probably the same as I would love to know too.
Yes.
Is there going to be some recording of some of the questions and some opportunity for us to kind of see what the results are so that we can adapt our thinking as you're also adapting your thinking?
I think that's a great point. And so what I'm thinking in my head right now is instead of just waiting until that January 11th date, maybe I'll have an ongoing document up on the website so that you guys can kind of see rolling developments. Yeah, thanks for the suggestion.
Yeah, that's definitely what we'll do. Try to turn it around as fast as we can. So, ideally we'll probably respond to individual questions through email or, however, and then make sure that we have a running list of Q's and A's on the website.
If you make it a blog, then we can sign up and it'll automatically.
Okay, yeah, I can do that.
It'll make it so much easier for you all, as opposed to hurting the rest of us.
Yeah. Okay. Yeah.
That's good.
Thank you.
Been there.
Valerie, do we have any other questions on the chat box that we've missed?
Not at this time.
Okay, thank you.
Not at this time.
Any other in the room? Observations, comments that you want to share with us as we finish this up? Yeah.
Helpful information for you to share would be what information the foundation has about its own grant-making processes and practices and so on, as well as the information that you collect from grantees or ask grantees to collect.
Okay.
Great points. Some of that, just for practical reasons would probably need to be kind of at a second phase conversation. I mean,
That's okay, but just
yeah.
a general,
Yeah.
kind of in general,
Okay.
this is what we are collecting or asking grantees to collect, and this is what the information we have in-house about our grant making process.
Okay. Yep, we can definitely.
Not really specific, but just.
Sure.
It's like, are we in data collection mode, or are we?
Sure.
Does it already exist? It makes a difference.
Okay.
Yeah.
Okay. Any wrap-up thoughts? Unless.
Again, just appreciate everyone being here. I think the RFP, the proposal, will allow us to have more in-depth conversations with one or more applicants, and we kind of have an aggressive timeline for all of that, but hoping we can stick to it.
Yep.
Yeah.
Yes.
Do you have your review panel picked out yet? Or are you the review panel?
So we can describe, yes, we believe some KHF staff will be on the review panel. Some folks that have strong expertise in these areas that we would be assured would not be applying or influencing the process. And we're hoping that we can have a couple board members be part of this process. I would expect board members, one or more, I guess, to attend the kind of finalist presentations so that they can get a feel for the teams, get a feel for the work, ask any questions that they have. We're really trying to approach this in a way where we will have full board buy-in and, probably, realistic but good expectations from the board going forward. So, yep. Don't start calling our board members. Okay.
This is Valerie again. I do have a question from Maria Moeller.
Okay.
Maria would like to know, what if we learn that there are activities or needs that require partnerships later? Can we build flexibility into our budget and approach in order to address those emerging issues? And she has an example. For example, to facilitate bringing on a subject matter expert or community member to serve as part of our team in a subcontract opportunity.
Yes. Is that?
Yes.
Yeah, anything else?
So thinking from a review standpoint, if an applicant has already identified how they have relationships with organizations that have a wide range of expertise, that's different than a budget that when we need it will go out and we'll look to find who could do this. Yeah. So yes, I think that's certainly possible, but again, just the notion of partnership and collaboration and wanting to work with a team or an organization that has a lot of that has those connections, or where those connections can be pretty easily established. But that's certainly possible. All right, so RFP released in a couple weeks, and then let the questions.
Okay, I just want to say, this is Nadine. Thank you all again in the room and on the call. We just really appreciate you guys being here and helping us think through some of this, participating in the discussion. Please contact me at any point. I'm sure you will. And thank you.
Thanks.
Thank you.